Okay, so we are talking about LDN today. I did an in-depth video on LDN for my Complete Thyroid Fix students, and we're answering their questions as well. But I want to do a really brief overview for you. LDN is low-dose naltrexone. Now, let's do a brief review of what naltrexone is. Naltrexone is a therapeutic pharmaceutical that is used for addiction. So some people will use it for alcohol addiction, and others are using it for the treatment of opioid and other substance abuse addictions. And what it does is it blocks the receptors for the pleasure. So one woman in particular, she does a great TED Talk on her, and she speaks in depth about her alcoholism and how she tried pretty much everything, including all the 12-step programs to overcome her alcoholism, and she would always backslide. And once she tried low-dose naltrexone, she noticed that her craving subsided. She would still drink and would not experience the high from the alcohol, and therefore eventually stopped because it was that high that she was chasing. And when she realized that the high was no longer there, she no longer drank or binge drank. So I might not be giving all the details properly, but in general, naltrexone is used for substance abuse. When it's used in low doses, we can use it for the treatment of autoimmune conditions. And specifically, when we're talking, obviously we're talking about Hashimoto's. So those of you who do suffer from Hashimoto's and high antibodies, LDN can be used to reduce those antibodies. So I want to go over some of the other components of LDN, some of the other benefits of LDN. So LDN works on all autoimmune conditions, like we said. It also works on insulin resistance. So last week in my Facebook Live, we talked in depth about insulin resistance and how that impairs, high insulin levels will impair T4 to T3 conversion. It will bring up TSH levels. It will block T3 from getting into the cell. A whole lot of issues with high insulin levels. So LDN comes in and brings down those insulin levels and really does a great job on insulin resistance. Also, what we see is that it works at the level of the pituitary and the hypothalamus to increase growth hormone secretion. So rather than it's not directly a growth hormone drug where it's going to artificially raise your growth hormone levels, but it will stimulate the pituitary, much like a growth hormone peptide will do. It will stimulate the pituitary to produce more growth hormone. Growth hormone is the anti-aging hormone. It helps with injury. It helps with your skin and your hair. It helps with all forms of anti-aging. And so with that increase in growth hormone, you're also going to get an increase in muscle mass if you are working out and a decrease in fat mass. So it will help you burn body fat. In addition, growth hormone helps with sleep, and LDN has been shown to improve sleep. Now, why do we want to improve sleep? Well, sleep is important, and you're going to see how all of this connects in a big circle. Lack of sleep or bad sleep, not getting into a deep enough restorative sleep mode, will put you into a state of insulin resistance. Now, we just said, and you can go back and watch the video from last week, we just said that high insulin levels impair thyroid function. So you don't want to walk around with high insulin levels because in addition to impairing thyroid function, which runs your metabolism, high insulin levels will cause fat storage. So if you're walking around with hypothyroidism and high insulin, you are in a state of fat storing instead of fat burning. If you add on top of that sleep deprivation and lack of sleep, now you're adding a triple whammy to your already broken metabolism. And you will very easily put on body fat. So improving sleep through the use of LDN, although it is not a sleep medication, it does not work like an Ambien. It will improve the quality of your sleep, which will also improve growth hormone release. But since it improves growth hormone release secretion, growth hormone release, it will also, in turn, with that extra growth hormone, improve the quality of your sleep and get you into a deeper sleep. So it's all kind of feeding together here. Okay, also, LDN can modulate the appetite. So again, this is not working like a prescription phentermine or Adipex at killing your appetite. It is working at modulating your appetite. So you've heard me talk about berberine in the past and how it will take your blood sugar from being on a roller coaster up and down to kind of squeezing it into a nice wave-like pattern. Berberine will modulate the appetite. It will take away cravings for carbs and sugar. Some patients also report back that they have a decrease in appetite overall on berberine, very similar to LDN. It modulates the appetite. The other thing that we're seeing is it will modulate your weight set point. So if you have lost weight, I have one patient in particular, she's lost 90 pounds and now she is stuck at this same weight. She'll drop a little bit and then go back to it, drop a little bit and go back to it, as if that's her body saying, this is your weight set point where we'd like to be. Now it's a very healthy weight, but she chooses to go a little bit lower than that. She has a little bit lower goal. So it will modulate your body's weight set point as long as it's in the healthy range. As I said in the Complete Thyroid Fix video to my students, listen, if you're 110 and you're looking to get to 105, probably not going to happen. But if you are hovering in the 200s and you wish to drop down below that, that is where we can see LDN come in to modulate your body weight set point to drop you a little bit lower. Okay, let's see here. The other thing that we find it doing is reducing inflammation of the fat cell. So obesity is a state of inflammation. High CRP, high ESR, those are all points that we can measure to measure inflammation. But in general, when you are suffering from some type of issue, hypothyroidism, Hashimoto's, any kind of autoimmune condition, insulin resistance, type 2 diabetes, or obesity, your body is in a state of inflammation. This is coming in and reducing that inflammatory response at the cell level. So it's not inflammation that you think of like my shoulder's inflamed, my elbow's inflamed. It is reducing it at the cell level. So when your body is inflamed, when your fat cells are inflamed, they will grow. And what LDN can come in and do is actually allow those fat cells to shrink. So it's reducing inflammation at the cell level. And when those fat cells shrink, what you will find is that your clothes can fit better. And I told this story in my group today as well, but I'll tell it to you. There was a point in time when I was competing. Now, this is before I was diagnosed with hypothyroidism. Many of you have heard my story of gaining weight and being on a competition diet at the same time. I was preparing for a competition, but this was a time when it was actually successful before I was diagnosed with hypothyroidism. And I was losing body fat, but the scale did not move for 6 weeks. I was so frustrated. You have no idea. And I went to my trainer. I had a coach, I had a trainer, and I said, you know, the scale's not moving. He said, is your body changing? I'm like, rah, rah, rah. Well, yeah, it is. But he said, is your body changing? I said, yeah, it is. So my body was changing for 6 weeks without the scale moving. Fat cells were shrinking. Clothes were fitting better. That can happen. So LDN can come in and reduce that inflammation at the cell level. It also just improves thyroid function altogether. If you still have a thyroid. Now, LDN, let me side note this. LDN can be used for patients with a total thyroidectomy, a partial thyroidectomy. That doesn't matter. But if you have a thyroid still, whether you are euthyroid or hypothyroid with a thyroid, it will improve the production of T4 and T3 hormones. It will also assist in T4 to T3 conversion. So I highly recommend asking your doctor about LDN, looking into this a little bit further. And if you have any questions, please reach out to me. I would be happy to help you along.